What's up, everyone? So today we're going to go over different causes of low back pain. So I have Erin today here. She's going to help me out. And we're going to talk to you just simply about where you feel back pain and how oftentimes these areas correlate with certain types of problems. So I'm going to have Erin turn around here for a second and we'll just kind of walk you through some different anatomies. So this part of your spine we call your lumbar spine. It's your lower back basically. Obviously we have our glutes, which are kind of our butt, and all these muscles that go up and down your spine and into your glutes are typically the culprits to where you feel most of your pain. There can be structural changes such as a disc herniation or some sort of irritation with your joints in your back, which we call your facets. But a lot of times there isn't an answer to what's causing the pain. So what we try to do is we try to encourage you to use these muscles and strengthen this area of your low back and spine and glutes so that we can mitigate some of your symptoms and hopefully strengthen you, getting you back to function. We're going to go through a few different movements that'll help you minimize some of that pain maybe that you're experiencing while you're at home. And then if you ever need any more help, you can come on in the office and we can take care of you the best we can. All right, so the first pattern we want to focus on is hip hinge. So when we don't want to bend from here, we want to bend from here, which is our hips. So Erin's going to do what we call a deadlift, which can also be the main pattern you see in a hip hinge type movement. So you see as she lowers the weight, you see that she's bending from her hips, not her lumbar spine. Erin, can you do like a bad one and really cave out your lumbar spine? Right, so that's what we want to try to avoid when we're doing deadlifts, especially when we're lifting things. It's not that that's causing the injury, but oftentimes when our backs are sensitive, this can make them more sensitive. The next, another basic movement that I always like to try with my patients is called the glute bridge. So what you're gonna do is you're gonna plant your feet on the table. I want you to push through your heels, and then all I want you to do is lift your hips as high as you can to the sky. Perfect. So that's the basics of a glute bridge. Then there's different breakdowns we can do. One, we can have Erin really tighten up her core here. So really squeeze hard like I'm about to punch you. Good. And then lift your hips up. Perfect. The other one we always like to do is to have her externally rotate. So she's going to push into my hands as she pushes out, creating external rotation through the hips as she glute bridges up. And then the final and third one she's trying to do is I want her to squeeze in really tight. Squeeze in with both legs here, squeeze my fist, there we go. And then bridge up nice and high, good, back down, squeeze again. Yeah, perfect. So again, just trying to fire different patterns of muscles through the glute and hip. Glute, firing quad, firing adductors on the inside parts of our thigh, all can change, and our core, all can change the way that you're feeling pain and can strengthen your back over time if done appropriately and consistently.